Hi, and welcome to our first in our eight-part series on weight management for breast cancer survivors. This is a brand new series we've created to help support those navigating breast cancer survivorship on their journey to maintain a healthy weight or achieve a healthy weight. So, for those of you who don't know me, I'll introduce myself in a moment more in depth. But I'm Jess Cording. I'm a registered dietitian, health coach, and author. And here at the Valley Breast Center, I support our high risk and survivorship patients in our breast surgery clinic. So, I am so excited you're joining me for this webinar. We're going to talk today about just to give an overview, an introduction to this topic. It's multifaceted, there's a lot to cover. We really hope that you will join us for the rest of this series. So I'm going to share my screen and we will get into our presentation for today. All right. So let me just start this presentation very quickly. All right. So we're talking about weight management for breast cancer survivors. Specifically today, I'm going to demystify some of the weight changes that are related to breast cancer treatment. Okay, so just a little background about me. I'm a dietitian. I'm a certified health coach. I also happen to be a certified Pilates instructor and Reiki practitioner. And I bring a little bit of everything to my work here at our center. I work with our patients to help them improve their quality of life through diet, exercise, and other healthy lifestyle habits, all of which we'll be talking about throughout this series. I also contribute to the Valley Breast Center social media and host a monthly food demo on our Instagram. So if you guys are on social media, would love for you to join us, and I'll share information on how to do so at the end of our presentation. So, okay, when it comes to weight management, there are so many factors. So we're looking at, for example, things around mindset. That is a huge piece of the picture, as well as nutrition, the role of movement, hormonal considerations, sleep, stress management, and nurturing our mental well-being. So we take a comprehensive approach. So this is why that we have broken down this into 8 different topics, because if we were to just do one presentation, 1 hour on weight management for breast cancer survivors, it would be so rushed. There would be so much we would have to leave out. So we wanted to be able to really take our time and dig into these topics. So, okay, we're going to talk today about some of the most common weight management challenges for survivors, specifically how breast cancer treatment may impact weight. We'll talk about hormones and weight changes, that connection. We'll touch on some other important factors in weight management as well, such as different medications and lifestyle changes. And then first steps. It's very important to me as a provider that whenever I am presenting information, that I always offer some kind of actionable advice or tips that somebody can take with them. So I am definitely not going to leave you hanging with just telling you all the things that might be going on. Demystifying is important, but then it can help to do something with that information. So, some of the most common weight management challenges that breast cancer survivors face are unintentional weight changes. So, for example, many women report gaining weight during and or after breast cancer treatment, and we'll dig into that in a moment. And what happens very often is that many find it easier to gain weight and or much harder to lose weight after treatment. And while some people do lose weight during cancer treatment, specifically breast cancer, it often is as a result of chemotherapy side effects, things like nausea, vomiting, decreased appetite, or stress. Absolutely, people who are not on chemotherapy may lose weight due to the stress and what they're going through. That is a huge factor we cannot ignore. So again, but in all of these cases, unintentional weight changes. So today we'll mostly be talking about factors in unintentional weight gain in breast cancer survivors, but this presentation is meant to be inclusive of all breast cancer survivors and those looking to reduce their risk or support someone who is navigating breast cancer treatment. And just to know, not everybody gains weight after a breast cancer diagnosis. However, it is common. And weight gain in breast cancer survivors can be related to a number of factors, such as medications. And again, we will talk more about that, reduced physical activity, hormonal changes, and then, of course, mental and emotional challenges that come up during treatment. Okay, so more on that. So again, not all survivors will gain weight after a breast cancer diagnosis. However, studies have shown that it is very common. Okay, so what's average? A lot of people want to know, where are they at in comparison to others? And we should never really be focused on comparing our journey to someone else's journey. Every person is on their own path, has a unique experience, but it does help some people to just understand if their experience is quote unquote typical or average. So studies have shown a variety of outcomes in terms of how much weight gain is common or what's considered average, we'll say. So for example, we have studies looking at survivors and treatment showing ranges from 2.2 pounds to 11 pounds, other studies showing an average of 2.64 pounds. Uh, for example, other studies have shown a little bit higher, so 4.4 pounds after 2 years. And then again, a little bit more each year. So 1.74 pounds at 1 year and 2.71 pounds at 3 years. And again, these are averages. Not everyone is going to have this experience, but these are just some numbers that have come up in a few studies. And if you're looking at those numbers and you're like, that doesn't sound like a lot. Um, and to your point, like it's not always significant, right? But weight gain may increase risk of recurrence, especially if it is significant. When I say significant, I mean, more than 5% of one's body weight, or for example, if there's a big difference if somebody gains 2 pounds versus if they gain 20 pounds. And what does sometimes happen, however, is that because of the metabolic changes related to treatment, which we will talk about, many find that they gain a little weight gradually over time and that it continues to be hard to lose that weight. And over time, if somebody does end up gaining a lot of weight, even if it's not in a short time frame, it can be a longer time frame. When there is excess fat tissue present, that can create inflammatory compounds that could potentially stimulate growth or expansion, I can talk today, of breast cancer cells. So again, every person is different, but this is what comes up when we look in the literature. And, so this is why this is important to be talking about. So there are certain risk factors that may impact someone's risk of gaining weight, or certain things that may make someone more likely to gain weight as a result of treatment, is what I mean. So a few, and some of these may be very obvious to you, some maybe you haven't thought about them as much, but a few that have been highlighted in research. So having gone through chemotherapy and or radiation therapy, a lower BMI at breast cancer diagnosis. This is not necessarily specific as to somebody has underweight or if they are of a normal weight BMI. I hate the word normal, but normal weight category. BMI of 18.6 to 24.9. Premenopausal status, that seems to also be associated with increased risk of weight gain after treatment. Being of a younger age. And then this one comes up a lot, reduced physical activity. This could be due to surgery, fatigue related to treatment, mood changes, sleep, etc. Hormonal and metabolic changes. We will spend some time talking about this. So this is another big factor related to treatment. And some of this, I will say, catches people off guard. They may not be fully aware of how these things work. So I wanted to demystify some of that tonight. And then diet patterns that may be impacted by physical and emotional challenges of treatment. So an example of a physical challenge might be that somebody is unable to tolerate, certain foods and therefore has to stick with certain things that are maybe more like high palatable, like more processed foods, or they're experiencing cravings, an emotional challenge, stress eating is something that might come up. Or, somebody is unable to prepare food and they need to rely more on like restaurant food or convenience foods. That might be an example of a physical challenge. All right. I wanted to talk a moment about medications because one of the most common questions we get from our patients is, do breast cancer medications cause weight gain? And this is a tricky one because it's use of medications designed to protect against hormone receptive positive breast cancer have been associated with weight gain. but it's not a guarantee that weight gain will occur. And what's really important is to look at why weight gain is common. Um, because it's not just that someone takes this medication and then automatically weight changes, right? Like there's different reasons why the body is more inclined to gain weight while someone is taking these medications. So that's what I want to talk about. All right, if you see a lot of text on here, don't freak out. I will talk you through this, but we go through a number of metabolic changes throughout our life for so many different reasons. And when someone is put on a medication to reduce breast cancer risk, or if someone is using chemotherapy as a part of their treatment, those medications can potentially have metabolic consequences. And these are not necessarily to say that someone is stuck in a place they don't want to be while they're taking these. It doesn't mean that every person will experience huge changes in these areas, but this is what has been shown to be possible and something to keep an eye on. I always like to say that awareness is a really important first step. So sometimes just knowing what's going on can help take off some of the stigma, the shame, the fear around treatment related weight changes. So, just to start with glucose metabolism and insulin sensitivity. So, glucose metabolism, all I mean by that is our body's ability to metabolize or utilize glucose. So, turning what we eat into food, the way that our body processes glucose. So, you're going to find, most of the time you're getting glucose from foods that are carbohydrate sources. So, one way of looking at it might be how efficiently your body takes the carbohydrate in the food that you eat and turns it into fuel for our body cells. So, an insulin sensitivity, insulin is a hormone secreted by the pancreas in response to presence of glucose. So, having a high level of insulin sensitivity is a good thing. That means that the body has a well-oiled system in place where the pancreas is able to secrete the insulin needed to metabolize that glucose to do what it needs to do. Um, when someone has decreased insulin sensitivity, that means that that process is not as efficient. So it has been shown that aromatase inhibitors, such as anastrozole, letrozole, and/or chemotherapy, have been linked to higher blood sugar levels and a decrease in insulin sensitivity. Another thing that can come up are another thing, changes in lipid metabolism. And lipid is just a fancy word for fat. And when I say lipid metabolism, I'm talking about how efficiently our body utilizes and processes the fat that we eat in foods. So what happens sometimes with what's been observed with uses of like certain medications, for example, like the aromatase inhibitors. So increase in circulating lipids. And so that examples of that would be like high cholesterol levels, high triglycerides. And this increase might also be linked to that increase in glucose metabolism. Um, so what's going on is that both fats and carbohydrates, so lipids and glucose, do play a role in energy metabolism. So using what we eat to make into energy for our cells. And a lot of this is happening in the liver, not all of it, but a lot of it. And when the liver is going through a lot of stuff, because the liver, we're asking it to process a lot when we're introducing medications. And then if there's stress in the mix, stress also does a number on our liver. So, when the liver is working less efficiently, that can contribute to a higher, it's less able to do as good a job of processing fats and other things. So that's why you may see changes in cholesterol levels. Not the whole picture. One thing I will add just independently of this is that weight gain can also contribute to higher blood sugar levels and higher cholesterol levels, higher triglyceride levels. So there are a few things that can impact these numbers, but this is just something to have on your radar. And I wanted to talk about leptin for a moment. So, leptin is a hormone produced in fat tissue that is positively correlated with body fat mass. So, what I mean by that, the more fat tissue that somebody has, which you may sometimes see called adipose tissue, the higher their leptin levels tend to be. So, why this can be problematic is that this can lead to leptin resistance over time. And leptin specifically, it helps regulate our hunger levels. So this is a key part of supporting maintenance of a healthy weight for the long term. So if somebody is resistant to leptin, that means that they're less perceptive of when they're full. Um, so when our body's functioning properly, leptin kind of suppresses the appetite until someone is at an appropriate weight, or or if it's time to eat next. For example, if you are like in a healthy situation, leptin, somebody wouldn't feel hungry until it was, their body had processed their nutrients and it was time for them to eat. So if someone has leptin resistance, they've developed leptin resistance, they may feel hungrier, and may end up eating more, even if their body has enough fat stores to give them what they need. So that's where that can become problematic for weight management, that someone ends up feeling hungry all the time. Also, it's just something to know. I know I've been talking a lot about AIs, but some studies have also linked use of tamoxifen and raloxifene to higher leptin levels. So it's not just the aromatase inhibitors. This is something that has shown up with a number of medications. All right, so let's talk about tamoxifen for a moment. So tamoxifen is a type of hormone therapy to protect against breast cancer, which is known as a selective estrogen receptor modulator. Say that 3 times fast. So it works by attaching to estrogen receptors in breast cells so that estrogen can't bind to them. And this helps slow the growth and the reproduction of estrogen-sensitive breast cancer cells. So this is used for those who have had hormone-driven breast cancers or are at high risk of developing these. So while tamoxifen use has been associated with weight gain, interestingly, studies have not established a clear link. So there's really nothing definitive that says, yes, this is why tamoxifen seems to cause weight gain, but there are a few theories. So one is that tamoxifen use may impact sleep and or reduce exercise tolerance. So with sleep, and we'll touch on this a little, there's a whole other presentation, by the way, on sleep. So we're going to do a deep dive into sleep in a few months. But just to know that when sleep deprivation is in the mix, that can contribute to higher levels of inflammatory stress compounds that impact metabolism. This can impact motivation to make healthy choices and to exercise. So that is, and also just when your energy is lower, you may not feel that you're exercising at, a peak level for your body. So that can definitely come up. Then metabolic changes like increased leptin levels, that can play a role as well in weight. So that's definitely something we can't ignore. And then emotional stress. I don't think this one gets enough airtime. And this comes up with any breast cancer treatment, by the way, or any preventive care as well, if we're talking about risk reduction. That emotional stress is huge. And that can definitely relate to lifestyle changes that promote weight gain, whether that is, if it's killing sleep quality, that's one right there. A lot of people experience that. Appetite changes. Some people may find that they eat more when they're stressed, or for people who find that it's hard to eat, sometimes initially that can lead to weight loss, but sometimes if the body's not getting enough nourishment, it responds by shutting down metabolism, slowing metabolism down. Or, feeling like no motivation to exercise or make healthy food choices, food cravings. Those are all things that can come up. And so, okay, to go back to aromatase inhibitors. So this is another type of medication used to protect against breast cancer and recurrence. Um, and they lower the level of estrogen by blocking a substance in the body called aromatase. And the aim of lowering the estrogen in the body is to prevent, stop, or slow the growth of estrogen-driven cancers. So because they suppress ovarian function, some of the side effects of these drugs have been associated with weight gain. So I wanted to spend time talking about that. Um, okay, so reduced levels of estrogen. This is important because it may be associated with symptoms that can promote weight gain and make it harder to lose weight if no changes are made to offset these changes. So I wanted to highlight that. This is not a guarantee that because someone is experiencing changes in estrogen levels that they will gain weight and that's the end of the story. There are lifestyle changes that can offset these changes. But some of these side effects that have this impact are loss of muscle mass. As we lose estrogen, and this happens naturally throughout the life cycle, but when we introduce a medication that more abruptly lowers estrogen, this effect is more pronounced, accelerated. So a loss of muscle mass. And that matters because muscle, it weighs more than fat. So it's going to show up as a higher number on the scale, but muscle burns more calories than fat tissue does. So the more muscle somebody has, the higher their metabolism. So if somebody is losing muscle mass, and I hear this all the time is, people are really, if somebody notices that suddenly they may not have changed their diet or their exercise, but either they're gaining weight or it's harder to lose weight, they'll say that what they used to do to lose weight doesn't work anymore. Or they may notice their body looks different, even if they're, even if their number on the scale has not changed at all. As we lose muscle, there is more fat tissue. And what often happens during that kind of change is that the body tends to redistribute body weight. So there is more fat tissue around the midsection. So that comes up very often. So that's one thing that can come up. Sleep disturbance, I touched on that a moment ago. That's a very common side effect that can have metabolic effects. Mood changes, which can impact motivation to eat well, exercise, and can also disrupt sleep. And then I'd be remiss not to talk about joint pain or fatigue. Those are also common side effects that can lead to reduced physical activity and reduced exercise tolerance. So those are a few ways that aromatase inhibitors may impact weight. And again, they're not a guarantee, but this is part of the mechanism through which these medications can impact weight. Okay, there we go. All right, so chemotherapy. Some patients are very surprised when they gain weight on chemotherapy, and not everyone gains weight on chemo. I'm sure a lot of you don't need me to tell you that. But I do think there is this societal, society does paint this picture of the quote unquote cancer patient where it's someone who is, very, very thin, has lost a lot of weight, is very weak. And so something I found with my breast cancer patients is that when they're in treatment and they notice that their weight goes up, that's very surprising to them. And this can be related to a number of factors, but some of the main ones are fatigue, which leads to decreased physical activity, muscle loss, which is also called sarcopenia. And there is research linking certain types of chemotherapies to sarcopenia. So that is something to pay attention to. And also nausea that improves with eating. So that can come up too as well. But also, I just want you to know that not all chemotherapies impact every person the same. Two people can be taking the same drug and have completely different experiences. And there are other medications that might be used in the setting of breast cancer treatment. So that may contribute to weight gain. So for example, steroids. These are commonly prescribed to manage certain chemotherapy side effects. Not for every patient, of course, but for someone who finds themselves on steroids for a longer period of time, that may contribute to weight gain and or increased blood sugar levels. So that can also impact, by extension, your triglycerides, cholesterol. And then certain antidepressants and anti-anxiety medications have also been associated with weight gain. So these are just a few to know about. But I always like to highlight that your doctor would not prescribe these medications if they didn't feel they were truly necessary and important. And as with any aspect of your treatment, I always encourage having a conversation with your provider and really walking through your concerns and coming up with a plan together of what is going to benefit you. All right, I'm just going to take another sip of tea. All right, so I know I mentioned the word sarcopenia a few slides ago. And just by definition, sarcopenia is a progressive loss of muscle mass and strength. And this occurs in all humans. It may be age-related, or it can be a result of physical inactivity. When it comes to our muscles, if you don't use it, you lose it, and or unhealthy diet patterns. But it can also occur in cancer patients due to cytokine-mediated inflammation that's associated with certain health conditions, cancer being one of them. It can also occur as a result of the hormone changes that are related to menopause. So this is something that many of our breast cancer patients go through as the medications used in treatment or surgery as well sometimes comes up if we're looking at other cancers where we are looking at hysterectomy or ovarian removal, oophorectomy. So that can also accelerate or lead to sarcopenia. I realized I didn't I should define menopause. You can get, I'm sure, lots of you watching are like, I know what that is. You don't have to tell me. But clinical definition of menopause is defined by 12 months without a menstrual period. That is what is used to say that somebody is in menopause if they have not had a period in 12 months. So I just wanted to make sure I was clear about that. Um, and then losing muscle also results in a reduced metabolic rate, which I did mention earlier. So again, because muscle burns more than fat, the more muscle someone has, the higher their metabolism. So if you're losing muscle, metabolism tends to slow down. Okay, so as we said, menopause defined by having gone through 12 months without a menstrual period. Obviously, this process can start, there's perimenopause, which is that phase leading up to menopause, and that can last for years. Obviously, when somebody is experiencing surgical or medically induced menopause, that is very different. There is not that like transition time. It's just more immediate. But key hormones that impact our metabolism that we talk about when we're talking about menopause are estrogen and progesterone. And these, as we lose levels of these hormones, that is when you see hormonal changes. So decreases in estrogen and progesterone can make it more likely that a woman will gain weight around the abdomen. Additionally, sleep disturbances caused by these hormonal fluctuations and hot flashes are a very common one. They don't happen just at night; they can happen anytime. But the sleep disturbances are very common and can also contribute to weight gain. As I was saying earlier, due to things like release of stress hormones like cortisol, decreased motivation to exercise due to fatigue, and cravings for high sugar, high fat foods. Part of our body's inner survival mechanism is it wants to keep us alive. And when we're really tired, our body doesn't want us to be slow and sluggish and vulnerable to predators. It wants us to be able to outrun something that wants to eat us first, right? So part of what happens when we're tired is our body, it craves high sugar, high fat foods because it recognizes these foods as quick hits of energy. So in the high sugar context, or high fat is a more like slow burning energy. That's where you're looking at like storing energy up for the winter or times of famine. It's also worth pointing out that poor sleep, regardless of why someone has poor sleep, also impacts levels of hunger rate regulating hormones. So I know I was talking about leptin previously, but there's another one called ghrelin, which is very involved in our perception of hunger as well. So what happens is when you're sleep deprived, you are more aware of when you're hungry and less perceptive of when you're full, which is really inconvenient if you're looking at weight management. And then stress. I couldn't do the work I do and not talk about stress. We're going to have an entire session all about stress because it's really important and it does not get enough airtime. But stress has been shown to affect metabolism and weight in a number of ways. So one big one is that it can interfere with eating behavior. So that might be things like difficulty with, appetite regulation that drives cravings for really highly palatable, ultra processed foods. Things like stress eating, that's another example. Stress also can impact levels of those hunger hormones, leptin and ghrelin. Stress also has a way of really just depleting energy levels. And when you feel sucked dry, like there is very low motivation to exercise or make healthy food choices. Sleep disruptions, that is huge. We're going to have a whole workshop on sleep. Also, stress can lead blood sugar levels to go up, which can drive higher insulin levels and possibly contribute to decreased insulin sensitivity. And then again, I mentioned this previously, but when we're stressed, our liver is really put to work because a lot of these stress responses are happening in that part of the body. And so when we're under stress, our liver is working overtime. That can impair the processing of fat, which leads to that higher LDL cholesterol. Just to name one thing. And also too, when we have more stress hormones like cortisol and some of its friends circulating throughout the system, there is more that does promote a tendency to carry or gain weight around the midsection. So this is why stress management is a really important part of supporting weight management. And then sleep disturbance. So again, we'll go way more into this in a different session, but some of the short-term effects of sleep deprivation or sleep disturbances. And when I say sleep disturbances, that can mean, for example, changes in sleep duration. So how long you're sleeping, um, or suddenly someone starts noticing they're waking up throughout the night and it's hard to get back to sleep, and or changes in sleep quality. So, do you feel rested when you wake up? Do you feel like you're sleeping more lightly than before? Are you tossing and turning throughout the night? Those are all things that can come up. So in the short term, you're looking at effects like cravings for high carb, high sugar, and or high fat foods, feeling hungrier than usual, fatigue leading to decreased motivation to exercise and or prepare healthy foods. And for the longer term, things that can come up are chronic alterations in your leptin and ghrelin levels. So, we were talking about decreases in leptin sensitivity or developing leptin resistance is another way of expressing that. Activated stress response. So just having more of those stress hormones circulating throughout your body as on the regular. Resistance to fat loss, that can also go hand in hand with that. And decreased metabolism, again, because of all of the different things happening in regard to metabolism and stress. And then I also want to touch on reduced exercise. Exercise is one of the best tools we have for risk reduction and for weight management. So when someone is not able or does not exercise enough, that can result in changes with our health and our weight. So a few things that come up, burning fewer calories than what's being taken in, that can lead to weight gain if someone is just expending fewer calories because they're exercising less or are less active in their day-to-day life. So muscle loss, that, as we've talked about, has been decreased with a reduced metabolic rate, has been associated with decreased metabolic rate. Mood changes, that, exercise is a great stress management tool and mood booster. So, and someone is moving less, that can show up in mood changes. Energy changes, it also helps with energy. Again, exercise, because of some of its mood effects and energizing effects, can be a really great stress management tool. You'll often hear about endorphins, which are kind of like these happy chemicals that you get when you are exercising. So when there's less endorphins happening, that can definitely impact things like mood and energy. And then sleep disruption. So exercise has been tied to improved sleep quality. So I do encourage that if somebody's working on improving their sleep, that they also look at their exercise routine. And just to know, however, during periods where there is surgery and healing is important, or someone is going through a really difficult time with chemotherapy, like, yes, there could be times where we want to prioritize healing and rest and not overtaxing the body or putting too much pressure on oneself to exercise. But when someone is in a place where they are able to move, we do encourage making it a part of day-to-day well-being practices. Any movement is better than none. You don't have to go to the gym for an hour for it to count. And we in our presentation on exercise, we will go way more into what the research says about exercise and weight management. But big picture, what I want you to know is just move your body in a way that feels good. So, okay, like I said, I didn't want to leave you hanging with just like, okay, this is what's happening. Like, I wanted to give you some actual steps you could take to address weight changes. And it's never too late, by the way. You can be currently in your treatment, you can be 10, 20 years out. It's never too late to address these things. Talk to your provider about making a holistic plan to support your goals. Um, you can consult with a registered dietitian like myself to create an individualized, sustainable, healthy eating plan that's also designed to decrease your risk of cancer and other illnesses while also promoting healthy metabolism and weight gain or weight management, I should say. And when I say a healthy eating plan, I don't necessarily mean a meal plan. It's for some, that is a great tool, but it's also about establishing what you need to be in a good routine. Having some basic strategies you can implement, having, a loose framework that you can work from. It doesn't have to look like Monday, Tuesday, Wednesday, this is exactly what you're eating at this time of day. Like it does not have to be that specific. Exercise regularly. I encourage including both cardiovascular and strength building activities. I did get a lot of questions about how can you support your metabolism. So strength training is one of the best things you can do because it helps build muscle. Strength training, that would be things such as lifting weights or utilizing weights in your training, resistance bands, body weight exercises such as like planks, push-ups, squats, that kind of stuff. And then closing the loop by consuming adequate protein. We're going to delve way more into protein in our next session, which will be on nutrition. We're also doing a session on nutrition and exercise and fitting them together. But protein, just, what I want you to know is that protein, it helps provide the amino acids that our body needs to build, repair, and retain muscle tissue. So you want to make sure you're hitting your protein goals. I commonly will recommend about 20 to 30 grams per meal as a goal. Emphasizing some of the leaner proteins like whole soy, like tofu, tempeh, edamame, fish, chicken, other poultry, eggs, that kind of stuff. Limiting the red meat and the processed meats. So that's helpful. But then also optimizing your sleep through sleep hygiene tools, supplements, and/or interventions recommended by sleep specialists. Maybe getting a sleep study done if needed to assess for any underlying sleep issues that might be impacting your sleep quality, and stress management. So something we are also going to cover in this series is weight loss medications. Everybody's asking about it. Everyone wants to know, is this something that we can use, should use, what's going to happen? So we are going to have a specialist on to talk about this. But I would say that is a very nuanced conversation that you need to have with your doctor because, these medications, they have the potential to be life-changing and life-saving for some, but they do come with side effects and considerations. You do need to still be looking at what you're eating, your exercise routine, your sleep, your stress. So it's a full comprehensive approach that is going to be different from one person to the next, and you need to make sure that you have support. So like I said, I know this is a lot of stuff to cover one day. This is why we're breaking the series down into 8 parts. I really appreciate you being here today. So if you are not already connected with us on Instagram, please follow us along. We post recipes, lifestyle content. We do our recipe demos there. So I just wanted to say thank you for joining me. Again, we're going to be covering a lot of stuff in this series, so I hope that you're able to join us or catch the replays for these. Have a wonderful day, and we'll talk soon.